Hello everyone. We're going to present a series of clinical cases. So every week we will present a clinical case. The first day we will discuss mainly the neurological deficits, and the second day we will work on the neuroimaging results. So let's go through the first case. This is a 13-year-old male neutered border collie that presented with a chronic progressive clinical signs of an altered mental status and posture. So as you can see in this posture, there is a head turn and a body turn, which is known as pleurototonus, towards the left. Also, the owner reported that the dog has been really lethargic, obtunded, not really reacting to the environment and it used to. So this is important. And again, what we're going to see during these slides are only the deficits. Therefore, for you to neurolocalize, take into account what you cannot see on the slides because it's considered normal. So just remember that what you see are only the neurological deficits. So the mental status was obtunded, and the posture, we seen spontaneous knuckling on the right thoracic limb and a left pleurototonus. When we talk about the gait, we could see a proprioceptive ataxia on all four limbs and a tetraparesis that was more significant on the right side of the body, and you can see on the video this spontaneous knuckling on the right thoracic. When we put our hands on, what we can see is that there are postural reaction deficits on the right pelvic limb and on the right thoracic limb. The spinal reflexes were normal on all four limbs, and the postural reaction on the left side of the body was also considered normal. The other deficits that we can see on our patient was there was an absent menace response on the right eye, and there was, as you can see on the video, there was decreased facial sensation on the right side of the face, and it was considered normal on the left side. So we have to summarize the deficits that we see in this 13-year-old male neutered border collie with, as I said, a chronic and progressive clinical signs of an altered mental status. It was considered obtunded with left pleurototonus. When we evaluate the gait, there was proprioceptive ataxia on all four limbs and an ambulatory tetraparesis with a spontaneous knuckling on the right side. Postural reaction were decreased to absent on the right thoracic and right pelvic limb. The menace response was absent on the right eye, and the facial sensation was absent on the right side of the face. You have to tell me what will be your neurolocalization, where you explain all those neurological deficits, and then though that neurolocalization can be lateralized, could be right, could be left. Just think about these answers, and then we will have to list our list of differentials, and it's very important that we think about or use the clinical reasoning. So we need to think about the onset, and we know that this has been a chronic onset. The clinical course has been considered progressive. There are clinical signs of lateralization. There was not obvious signs of pain, and then you have to think about your neurolocalization in this 13-year-old male neutered border collie, and that will help us for considering the severity of the clinical sign, the progression of the time, to list our etiological diagnosis. And again, think about, based on this clinical case, what will be your most likely differential diagnosis, and you can list one or two considering them the most likely. And as I said, tomorrow, in a few days, we will post the answer and discuss the neuroimaging findings in this particular case. Thank you so much, and I'll see you soon.